I touch because then it gets kind of weird. So I'm seeing the ears, they're symmetrical. I don't see any lesions so far, but I'm not touching yet. Do you want to put this on and take your mask off? That way we can all see your face. All right. So I see the nose is symmetrical. He has a foreign body in his nostril. No, I'm just kidding. All right. The mouth is symmetrical. Teeth look nice. Can you stick out your tongue for me? Can you smile? So I just want to make sure everything's symmetrical. Bite down for me. Yeah, he's got really nice teeth, jaw lines. Very good. All right. So now that I've assessed everything without touching, I'm going to start to inspect with my hands. I'm going to look all around the ear. I'm going to grab the pinna. Do you have any pain here? No. And then remember, always look at the back of the ear because there can be pressure ulcers back there. That is true. Your oxygen patients with glasses. Do you have any pain here? No. All right, I'm going to keep going with the ears because I'm already here and that's the way I want my flow to work. So I'm going to ask him, do you have any pain in your ears? Drainage? Feel like your ears are stopped up?
No.
Have you ever had tubes in your ears?
No.
Okay. So what I'm going to do is I'm going to try to visualize your tympanic membrane. So I'm going to use this to look in your ear, okay? Let me know if you feel any pain or tenderness. So I'm going to find the hole. I'm going to advance in. And I see this is the right side. I see the cone of light at 5 o'clock, okay? Remember, it's always down towards the jaw. So 5 o'clock here, 7 o'clock here. What I don't want to see, red, bulging, angry tympanic membrane, absent cone of light, anything like that. All right, everything looks good. Any questions about that so far? Now while we're doing it, we'll go ahead and do the whisper test.
Black truck. Black sheep.
All right, so you can hear just fine. Then we're going to check bone conduction in the Weber. Tell me if you can hear.
Yes.
Can you hear out of both ears? Just one?
Oh.
All right. What about here?
Yes.
Out of which ear?
Oh.
Hey, which ear? This one? Oh, it's
No,
soft.
I was like, no, I can't hear that.
Here?
Yes.
All righty. Can you hear this?
Mm-hmm.
And can you hear this?
Yes.
All right. Good. Weber, Brian. Can you stand up for me, sir? All right. This is going to feel a little strange, so I'm going to stand behind you, and I want to ask you to close your eyes. Then I'm going to notice and see if he does any swaying. All right. Always hold your hands up. The reason you do that is because you don't want them to fall. And if they kind of get unsteady, you want to be ready to catch them. Okay? All right, sir. Let me get the stool back out for you, and you can have a seat. All right. That's your complete ears. Any questions on ears? You missed anything? All right. Now we will do the nose. So we're just going to inspect the nose, the symmetry. Do you snore?
I don't think so.
Do you have any type of allergies, chronic allergies, sinusitis? Just allergies? Okay. Do you currently have any discharge from your nose?
I don't know.
Okay. Is it running, wet? I mean,
I just blow my nose
current?
away.
Okay.
And that's normal.
Not constant.
No.
Okay. All right. Have you ever broken your nose? Okay. I want to know that for deviated septum, but I also want to look. So I'm going to ask him. I'm going to kind of go down first and look, and I want to look for patency. Like, that doesn't make sense. I want to look for openness of both nerves. You can see if the septum's one side or the other, okay? Can you look up for me? And then I can see that better, okay? And then if I were to get close enough, I can see the nasal turbinates, but I'm not going to do that because of COVID. I don't think she wants y'all to get that close either right now. Can you close one nostril for me, please? Can you take a deep breath? Are you able to breathe through that side of your nose? Can you do the same on the opposite side, please? Are you able to breathe through that side of your nose as well? All right. So that's to check for patency. Did we check everything on the nose? I believe we did. Alright, and then we're gonna look in the mouth and at the throat. So I'm gonna have him open his mouth. I'm gonna have him stick his tongue from side to side. Can you touch the roof of your mouth, please? So we see the frenulum's intact, and if you look, you can see the other structures of the mouth that you guys were learning about. All the terms kind of take my mind right now, but you can see the ducts, you can see the glands. Alright? Can you stick your tongue out and say ah for me, please? Alright, so I see the uvula, you're good. I see the uvula rise, I see the soft palate rise. Okay, I'm looking, I would move the tongue out of the way or ask him to move, and I would look at the horseshoe down here at the bottom of the tongue. That's where your oral cancers hang out and your crazy lesions and stuff like that. Okay, let me see one more time. Can you move your tongue out of the way or no? I can suck mine back in there. Do you have tonsils?
Yeah.
Sorry. I think his tonsils are about a 1+. I can.
Wait, you want me to do it?
I mean, I can suck mine down into the bottom so you can see without like the tongue depressor, but some people can't. Oh yeah, that's not bad. That was almost there. There we go. Yeah, so his tonsils are 1+. I can see them, but they're not there. Now I have 2+ tonsils. I have pretty large tonsils for an adult. So you can always see mine, but I can see his kind of back there behind the tissue. Okay, are y'all able to visualize tonsils?
Yes.
Good. Alright. So, I think that's all with the throat. How'd we do?
Good.
Good? So, alright. Yes.